Hi everybody, I'm going to be talking today a little bit about self-treatment of your foot, and this is something I do almost every time I'm warming up to exercise. I find it immensely helpful. What I'm trying to do is actually increase the mobility of the bones. I'll show you also some soft tissue things that you can do for the muscles. Okay, so first things first, this is a foot, obviously my foot, and what I'm going to do, this is what we call the ankle bone, and you can kind of see the little ankle here, and if you feel along this side of your foot, you'll feel a little bump here. This is called the navicular bone, and it's because it's on the navel side or the belly button side. And what you're going to do here is you're going to pinch that bone above and below, and you're going to pinch your forefoot. These long bones here are called the metatarsals, and we're going to go ahead and we're just going to turn these all at the same time. We can pull and turn and just kind of wiggle that bone and just get that nice and loose. And then we're going to move down, in between the navicular bone and the long bone is another bone, and that's called the first cuneiform. And the cuneiform you're going to grab the same way, and you're going to right in line with the first metatarsal, that bone, that long bone of the foot here. And you're going to again pull and just twist in and out. So you're doing both at the same time. And then you can move this bone here, the metatarsal, up and down like that. And then we could take our big toe, and if you want, you can try to pop it by holding the whole thing and kind of pulling it forward. Never pop your bones by trying to pull it down or by doing this with your hand. This is much safer, much healthier to just kind of pull it lengthwise. And so here you can just kind of twist it and see which way it doesn't twist or which way it does twist, and just kind of pull it in the direction of the way it likes to go, and just kind of pull it and hold that pull until it feels a little bit better. And you do the same thing with the next joint up, which we call the interphalangeal joint, because these are called phalanxes or toes. And we take that toe joint, we're just going to pull it and see which direction it likes to twist in. We take it the way it wants to go, and pull and hold it, and eventually that's better. So here was our navicular bone, and here in between the navicular bone and the long bone is another bone, and that's called the first cuneiform. This cuneiform lines up with the second metatarsal bone. So we go here on the end of it, and we see if we can turn it, and then now it likes to turn this way, which we would call inversion. And I would just pull it till I feel it, and then invert it. Then I could twist it in and out and loosen it up that way. And then I could take that cuneiform, I could move it up and down like we did the first one, and just kind of play with it until it moves really good. You can take the two and you can move them together in opposite directions, the first and second cuneiform. And then we're going to go to the third cuneiform. So the third toe, you trace that up the long bone here, and again find that navicular bone. You go between that and the long bones, and we go down to match it up with the third cuneiform. And again, we're going to pull it back and forth and internally, externally rotate it, twist it in and out. We can twist it in different directions, and really just trying to get that bone, relaxed and moving. We can traction it and twist it together. And then we can take that long bone and stabilize the cuneiforms and just kind of move it up and down and in and out. And we can go ahead and take the two and go the same thing and just kind of twist them. And then we can do the next one up and down, and then we do this one here. Now, on the outside of the foot, there's the fifth metatarsal that goes right into the cuboid bone. And the cuboid bone, you can go above and below. So this little bump there, that is a part of the fifth metatarsal, and we go closer to the body, closer to the ankle, and right here is this little, cuboid bone. And again, we can see we can kind of twist it in and out, and my cuboid twists one way, it doesn't twist the other way. And now I can go ahead and I'm going to do it from this side. I'm going to hold this side here, and again, twist it in and out to try and, I can step on the gas if I wanted to. I can do lots of different things to try and move that bone and twist it. You can pull on it and see which way it wants to go. Just gently going through. And then here again, we can do the same thing that we did for the big toe. Okay, just going down on our toes and moving them back and forth. And then we can take a little bit of just normal lotion and lotion our feet and massage them a little bit. Okay, massage the heel, just massage the toes, getting all the fascia nice and soft and relaxed. Okay, and then we can even, this big muscle here is called our calf muscle. I know I'm showing a little bit of leg, but hey, that's what gets the clicks. All right, now you go ahead and take that lotion, you can massage it in. You just go ahead and you're putting on socks, just gently rolling up and pulling it towards you. It's interesting. You can go ahead and massage into the muscle. Just, you can bend the foot back and forth. You can find a spot that's tight, just until you get all the lotion in there and it feels a little bit better. Thank you all for joining me in this nice stretching exercise, and I hope it helps a few people out as it's helped me out over the years.